Chiropractors are human too, but in my career, I've had multiple people say to me something along the lines of, well, you're a chiropractor. It must be nice to never have back pain. My friends, that cannot be further from the truth. The number one occupational hazard for a chiropractor is, you guessed it, low back pain. So this affects all chiropractors just like it does anyone else, and it has affected Dr. C very recently. So I woke up about 3 days ago with a really painful low back. It's probably the worst episode that I've had in a few years. So first, I wanted to share with you, as a chiropractor, what treatments I utilize, and secondly, I want to answer the question, did it work? When you're being educated by a professional on any topic, you really learn a lot when you see them take their own tools and put them into practice. Of all of the lessons that this professional can potentially teach you, you start to see where they place the most value. Case in point, if you're being educated by a financial advisor, maybe they're teaching you about investing, there's a whole lot of lessons that they could potentially teach you. Some of that material you'll utilize, some of it you may not utilize. But when they start to talk to you about what they themselves do for their own personal investing, you start to learn about where they place the most value. So it can be really educational for you, and there's a lot of lessons to be learned. Okay, let's talk about some of the details. First, I have no idea about how this happened to me. And that's actually fairly common. In my office, I would estimate that about 80% of the patients who come in, they don't know how their pain began. There was no car accident, there was no slip and fall, there was no lifting of a heavy object. They say it just kind of showed up, and that's the way it was for me. I just woke up and it was there. My pain level on Sunday, which was when this began about 3 days ago, was a 6 out of 10. But it did have spikes up to about an 8 out of 10. Depending on what I was doing, if I turned a certain way, it could spike up a little bit higher. The pain was mostly dull, but it had occasional sharpness, again, depending on what I was doing. Now, I would also say the pain was very consistent on day one. I don't think that there was any point in time where I didn't feel some pain. So 100% of the time, it was there. I wasn't even able to stand up straight. And if I forced myself to stand up straight by like pushing against a wall or something like that, it wasn't comfortable at all. So I didn't even want to try it just because it was too painful. Now let's talk about what I did to treat it. The very first thing that I did, and you had to know that this was coming, is I got adjusted. I'm a chiropractor, so of course this is going to be the very first thing that I talk about, but what you may not know is that I am lucky enough that my wife is also a chiropractor. So of course it was the very first thing that I did. I needed to make sure that my pelvis and lumbar spine could move properly. The second thing that I did was I stretched it. I didn't do anything fancy. You could probably Google the stretches that I did, the lumbar stretches. They were very basic and very plain. But the one thing that I did do, which I stress to my patients all the time, is I was consistent throughout the day. I would estimate about once every 1 to 2 hours, I was stretching my back out again. Now, the next thing that I did was I was sensibly active. And the reason I say it that way is because you want to be active, but you also need to listen to your body as well. It's okay to walk around and do maybe some light things around the house, but you really do not want to do more than you're capable of. And if you start getting more pain, of course you want to stop. The next thing that I did was I used a topical menthol gel. Some of you may be familiar with a product called BioFreeze. I know that's a really popular one. That actually wasn't the one that I used. I used one called Orthogel, which is very similar, but it uses menthol as an active ingredient, and menthol is a really good topical pain reliever. So Orthogel is my kind of go-to topical pain reliever, but you can use other ones like BioFreeze. I believe Bengay also has menthol in it as well. The next thing that I did was I actually used some Pilates exercises to keep myself active and to keep, again, my spine and my pelvis mobile throughout this day one. And that's going to be really important. Just like staying sensibly active throughout your day, I kind of think that Pilates is very similar in that you're lightly active and but you're not overdoing it. The last thing that I did for my pain on day one is I used a foam roller. Now these are really popular and you probably have seen them before, whether it be at a gym or at a store, or maybe you saw someone using one on TV. But this is something that is a part of my home arsenal of things to deal with back pain. Now let's talk about how it worked. My injury happened on a Sunday and I had a full schedule in the office on Monday, but I did feel well enough to go in. I'd rate my pain on Monday as a 2 out of 10 with occasional spikes up to a 3 out of 10. That's a 67% improvement from day one. Remember, I was at a 6 out of 10 on day one and I had spikes up to an 8 out of 10. I would also say that my pain was intermittent as opposed to constant. So there were definitely decreases in the frequency of pain. But I was really happy with how I improved from day one to day two, just based on how my symptoms improved. Now, I did continue treatment on day two. I repeated a few of the active care things that I did from the previous day. So I did my stretches. Again, I did them consistently throughout the day. I also remained sensibly active, which is kind of easy in a chiropractor's office because I'm always up and moving around, and I made sure that I wasn't doing too much. And I did also use the foam roller again in the evening. Now here I am on day three. It's morning when I'm recording this video, and I would say my pain today is at about a 1 out of 10, and I have yet to have a spike of any sort at all. And it did snow overnight here in Erie, Pennsylvania. So I did use a snowblower this morning and I remained consistently at a 1 out of 10. It didn't go above that. So I'm really happy with that. Now the next question is, where do we go from here? My plan is to be adjusted again today. Again, I want to make sure that my lumbar spine is nice and mobile. The reason that's important is because the better your spine moves, the more challenging it is for your body to send pain signals up to your brain and for you to feel pain. So I want to make sure that my spine and pelvis are moving really well. I'll also continue with my active care today, and those are all the things that I'll do at home, the stretching, Pilates, foam rolling, and things like that. I'll likely be adjusted 3 times this week, and then I'll decrease the frequency until I'm back to my maintenance levels, which for me is about once every 4 weeks. So I will also continue to do my active care and slowly decrease that until I get back to maintenance levels. One thing that I think is really important is that when I am out of pain, which may be over the next day or two, I may not have any more pain over the next day or two, knock on wood. So I still will continue to do my active care, even though I may go less with it, because I want to make sure that I'm doing everything that I need to do for my body to fully heal from this injury. And when the pain is gone, that does not mean that I am fully healed. So I will slowly decrease my active care at home. And eventually it'll get to a point where I just simply add in an extra stretch to my exercise routine. And that's just me trying to be proactive and prevent any future episodes of back pain like this. There are a few take-home messages from this video. 1, chiropractors practice what they preach. So if they're asking you to do something, make sure that you do it. Secondly, active care at home is essential to your recovery. If your chiropractor asks you to do an exercise or a stretch, do it. It's for your benefit. And number 3, if you don't feel very well versed in some of the therapies that we talked about in this video, talk to your chiropractor and develop a plan that can work for you too. Well, that does it for another episode of Dr. C TV. I am Dr. Jason Cardinali. I am on the mend, and I will see you next time.